Karl Popper talked about the importance of falsifying hypotheses. So it's not enough to just say that this is the way things are or that this is the way things should operate, but you actually have to test it. And in the case of the drug war, much like other totalitarian ideologies, like the war on terror or other things, which George Soros was very sensitive to, the truth is that the hypotheses that zero tolerance actually protected people from drugs, that sending police into schools meant that kids would use drugs less, that giving people a clean needle would encourage drug use, that the only way to get people off drugs was to break them down and degrade them and then build them back up. All those hypotheses were in fact false. And part of our job, my and Kasia's job and our team's job, was to elevate alternate hypotheses and test them. And many of them turned out to be true. Like giving people a clean needle does not encourage drug use, but does help people to feel more agency in the world.
I remember a visit to Central Asia, Kyrgyzstan, which was actually, because, as all of this is happening and, harm reduction is no longer a new concept in the global north, and there are all those people that are supporting us, then we started traveling, and I went to Kyrgyzstan and went to Osh. And in Osh, in Kyrgyzstan, I saw in a narcology clinic, inpatient narcology clinic, men who were in coma, induced coma, insulin-induced coma, as a way of dealing with your withdrawal. And to be honest, I just stood there stunned. And so the person who was in charge of it, his name was Dr. Burhanov. I think he sort of saw my expression of horror. And, and we were shown that intervention as, well, look, we're really trying to help people who are suffering. And that conversation was interesting because, he basically made available what was possible at the time in the small city of Osh, which is actually quite close to the Afghan border, where drug business was already a major issue, where young kids in Osh Market were there to sort of be drug runners. But he also was totally open to a conversation. And so I was thinking, well, how about methadone? That seems like such more viable and actually evidence-based approach. And so Dr. Burhanov stayed in a conversation with us, and a number of years later, I don't remember how many, actually did make methadone available to those people.
The thing that was so moving about it for me and so instructive, even though it was in the context of the Soviet system of narcology, which was this specialized Soviet response to drugs, is how much it revealed about how societies respond to drugs in general, which is the people who were in an insulin-based coma were in a coma because that was what was convenient for the system. The system was kind of working around the people, and that was true in so many things. Like when we did the survey of antiretroviral treatment, people would go to the AIDS center in a country where 80% or 90% of the people with HIV were people who use drugs daily, and there would be a sign on the wall that said, if you're under the influence of narcotics, please come back tomorrow. And what does that mean in the context of an epidemic that is totally concentrated among people who are under the influence of narcotics every day? It means don't come back. Or it means lie about the fact that you're using drugs. In general, a lot of my early work with Kasia was trying to get attention to HIV in Eastern Europe, which really hadn't been getting any attention anyway. Either it was the US or it was sub-Saharan Africa, but this part of the world, which largely was not working in English, was being totally ignored. We invited a New York Times reporter to come to a training with all these different people from 27 countries of Eastern Europe. And there was a very large article on the second page of the New York Times about HIV in Eastern Europe as a kind of forgotten epidemic, which quoted Kasia at the end, noting that it wasn't about needles and clean needles and syringes. It was about people being treated with absolutely no dignity and being ignored. And so that was the first manifestation of what would be a long and productive collaboration in trying to get attention to an area of the world and a group of people who were being ignored.
I think the shift from seeing replication of services as the ultimate goal to a moment where we pause and ask a question: what services are required and how can we meet those needs, is really the moment where the sort of drug users' human rights became clearly articulated. I think for us, it was mostly a process of expanding what we considered human rights. I remember a while back, I wrote a small piece describing my trip to Russia, to Tomsk, where I felt that drug users coming to a needle exchange and traveling for an hour and a half in the snow in minus 30 Celsius to get there were not really coming for a needle, were coming for a human interaction. And basically in appreciation of recognition of them as human beings that have broad needs, and hope that those needs can be met.
There were so many instances where basically people who use drugs or who receive medicine for using drugs were treated like drugs themselves, as something to be controlled or contained. And so in Ukraine, for example, where they use buprenorphine, another medicine that's prescribed, people had to come in daily, even though, for example, in Europe or the US or Australia, you can get a month's worth of medicine and take it home. People weren't allowed to touch the medicine themselves. A nurse had to put it under the tongue, your tongue, and wait for it to dissolve. You're talking about people who are very vulnerable and will become very sick if they don't get this medicine, and yet you're asking them to engage with government systems that are unreliable. So in Azerbaijan, in Moldova, in Kyrgyzstan, in Albania, those are all places that, for various reasons, for administrative delays, either they had the methadone supply interrupted or didn't have enough, and they would just cut people's doses, or tell them that there was just no more medicine.
I must say that I was really, really impressed by people's recognition of the problem and willingness to work on their, in their countries, in their communities, to put it into practice, because that truly was a very tall order. Again, I think that our job was easy because we were in a private foundation supported by our institution, and had this incredible group of people around us that sort of the harm reduction tribe that were investing in us, supporting us. But imagine being, Aijan or Igor or Burhanov out there on their own and being willing to take the risk and become the harm reduction advocate in their own countries.